Stevens, Kippenway Vet Surgery Cobart, and my supervisor is Prue Chambers. So we're doing the pathology one, and we're just doing a mock one with Prue's dog Freya. So I got everything ready before we started to take blood. So we've got the request form book, the correct tubes, the EDTA, potassium and serum separator, all in that order. The bag, the correct bag to send them in, so you put them in the bag and the request form slip in the front.
Yep. And
then 10ml syringe with a green needle. So new one every time, even if you go in and you somehow don't get the vein or the dog pulls away or something like that, replace your needle.
Okay. Filling out the book?
So filling out the book, you fill out all the details, so owner, surname, animal's name, species, breed, how old the dog is, whether it's desexed or not.
Yep. And
then a brief history down here of what's been going on, if she's been panting or lethargic or anything like that.
And why is it important to have a history?
So the pathologist knows, sort of has an idea of, you know, things that to be looking for and all of that.
If we're sending away our normal full blood count, what is the one we circle?
So this one. Yep. So put the request date, collection date if different, say if because we can only send our bloods before 11:30 in the morning. After that we have to wait till the next day when the courier is around. We always mark urgent because we send them away to get tested. We get our results a lot faster that way. And then marking the date down the bottom here as well.
Yep, and signing it.
Yep, and signing it.
And just demonstrate, just on one tube, what you would actually fill out.
So owner's surname, and then the dog's name, date of birth, male or female, and then ward, which is us, which we would write our ward code.
Yep.
Which is 9COVA.
Yep.
And then sign down the bottom and the date.
Yep.
Yep.
Okay. Okay.
So this is Freya. She's 28 kilos. Now, she would be a dog that certainly two people would lift up onto the table, as there's only two of us here and one is videoing. We're not able to show you this at this time. But we would, I've already put my gloves on.
Yep.
So not trying to hold the dog and then do that later. Pop the muzzle on and then pick her up and put her on the table.
She's about to escape.
Yep, she is about to escape. Good thing she's good done. Tuck her in there.
Go.
Okay. So the correct position to hold the dog, if I was to hold it for someone else, would be much like this, a natural position. So when they hold the jugular up, they can then see that.
Yep. Can you hold the jugular up on this side so I can actually see it? Yep. And you would normally be on the...
I would normally be on the other side if I was to be holding myself. We're just a bit short-handed at the moment.
Yeah.
So
and why would you be behind the dog versus in front of it?
So you can be sort of a wall against their bum, that way they can't back out.
Yep.
And it helps them sit more comfortably. You know, they're close to you and all of that.
Yep. So shave up where you would shave for a jugular. She should sit there. If she doesn't, I will get closer.
Okay. So find where you're going before so we don't shave the entirety of the dog. And our clippers are cooperating very well.
And why would that be sometimes?
Because down here it's all different directions of hair.
Yep.
That's generally always where the jugular is.
And why is it important to identify where the jugular is prior to clipping?
So you don't have to clip the whole dog's neck. You just clip a nice spot that's discreet.
Yep.
And you can do it in that area. Yep. So then we would
You're right, Freya.
I'm not going to take her blood today because she's not unwell or anything like that. So gently planing in one direction with the alcohols, and if you rub up and down, you're going to give them a rash. Yep.
Yep. And then just hold the jugular up again and then explain where you would go in, and I will get a little bit closer. So I will hold her
Yep.
head up.
So I would go in just straight up here.
Okay, and just
So
release.
this is
Yep, so you can see that the jugular pops up there nicely because she
Yep.
is a greyhound.
if I'm having trouble
Cross.
seeing, I will hold and release a few times.
Yep,
And then it becomes very obvious it's straight down here, and she has a nice drain pipe.
beautiful girl forever.
So the reason we would go in the jugular
Yep,
is because it's a large vein that drains back to the heart.
Yep.
And it's easily accessible in most breeds and species. A time that we wouldn't go in the jugular is if a dog has, had a big wound and bled out a lot, or had access to rat sac and doesn't have any clotting factors, then we would go with a catheter in the cephalic vein. So holding that up, it runs straight up there.
beautiful. Go.
So once our bloods are then taken, we put them into the tubes in order of purple tube first,
Yep,
grey,
yep.
and then yellow,
Mm-hmm.
with a gentle mixing motion. If you shake, you will ruin the bloods and the testability.
Yep.
So just nice, gentle movements.
Mm-hmm.
Once they are all in there, because I've already pre-filled them out,
Yep.
pop them all into the bag and call the couriers. We send our bloods down here to Macquarie Pathology, where they await pickup and go to Vetnostics in Sydney. So until they're picked up, we store them in the fridge here. Sometimes we actually have to take them down there ourselves to get in there before the courier.
Yep.
Yep.